most people haven't heard of the disease we're about to talk about unless they're actually going through the process of suffering from it. It's called PCOS, and it affects more women than you can imagine. So, my name is Harun Rabbani. I'm a health specialist, particularly focusing on people with type 2 diabetes. And I'm joined by Dr. Ashish Paul, who is an Ayurvedic doctor, of course, and she also specializes in fertility, particularly for women and for their partners, actually. So, without further ado, Ashish, let's hit the ground running. Welcome back. Good to see you.
Good to see you too, and good evening to everybody else who's listening to us every Monday evening. We are here 7 o'clock. We have missed a couple of Mondays in between because of my patients, but we are going to be talking about polycystic ovarian syndrome today.
Brilliant. And so, straight away, I mean, I hadn't heard about it until only a few years ago because of the work that I do with people with type 2 diabetes. What is polycystic ovary syndrome, and why haven't most of us, especially men, haven't even heard of it, haven't got a clue?
Yes, well, men haven't heard of a lot of issues that women suffer from.
Yeah,
So you are a health professional, so you must have heard some of it. But
yeah, yeah.
just imagine normal man who wouldn't have a clue unless their partners are suffering from it, or they are at that point where they are trying to conceive, but they can't because of PCOS. So PCOS is what it is. We have two things. One is polycystic ovaries. So you can have ovaries where there are a lot of cysts. That is called polycystic ovaries. That's a completely separate disease. We are not talking about that. Polycystic ovarian syndrome now is classed as a metabolic syndrome, where it is a syndrome affecting not just one organ of the body. It affects multi organs of the body and has many more symptoms than just few peculiar symptoms.
Okay. So just to clarify, one is just talking about and I'm putting in lay terms. One is just talking about the ovaries themselves, and the
Yeah,
other one is saying what you're actually saying is what we're talking about. The syndrome
yeah,
is the number of diseases and the number of organs that are involved. Well, number of organs and systems involved in this one particular condition. That's significant
yeah.
because in the world of diabetes, a lot of people assume it's to do with just the pancreas. Well, when your pancreas is involved, your heart is involved, etc., etc., it
Exactly.
becomes that there's multiple facets. Okay, so what are the core or the most common symptoms of PCOS?
So PCOS, three main key characteristics that you need to have in order to be able to diagnose. One is the irregular periods. You may have periods 2 or 3 or 4 times a year. So not every month women or girls will have periods. Secondly, insulin resistance. And thirdly, high testosterone levels. So women, we everybody should know that women also have testosterone hormones, which is a male hormone, but the level of testosterone becomes much higher in the case of PCOS. So these three key events need to happen to PCOS women to be called as PCOS. And then there is excessive hair growth on the body, whereas balding or the male type balding that women have, they lose a lot of their hair on the head. And weight is an issue. They generally tend to be more obese or more can't control their weight. So these are some of the these are the main ones.
Okay, so that's fascinating already. You've painted, literally for me, painted a picture. I've already got in my mind some of the women I've come across
Yeah,
who've probably, based on the symptoms you've just seen, just observing, have probably got those symptoms. And the thing is, I'm guessing, like, it's one of those things that scares the life out of women who actually start getting hair growth and start losing hair, of course, from the head. So,
yeah.
what numbers of women, what percentage of women actually are likely, or what are the stats saying in terms of how many people get PCOS?
Yeah, it's 1 in 10. So it's a very high number. And PCOS is the major cause of infertility. As we see it, I see it in clinic, and also IVF clinics see it. but it is a huge number, and the issue is that it's increasing. We are getting we are seeing more and more women being diagnosed, more and more girls being diagnosed, also because we are getting more, a little better, and also that we are looking at, people are educating themselves and looking at their girls a bit more closely, or watching their
So,
periods more closely.
so at what age do they typically get diagnosed with PCOS?
Generally, PCOS, it will start, the tendency will start, girls normally would start their period 10, 11, 12, depending on whatever age they are starting their periods at. We normally give a year or 2 years for girls to settle their periods. That, okay, it's only in the beginning, and then they may not have set date or set number of weeks of occurrence of their periods. After that, periods should become regular, every month, every 4 weeks, more or less. But if that doesn't happen, that's when people then start to investigate, okay, what is going on? Why periods are not regular? And by the time you are diagnosed with it, it may be another 2 to 3 years before you're diagnosed. So you're looking at 15, 16 earliest, if you would be diagnosed, if you are in that part of the world where, or that you are very careful yourself and you have a lot of information. Generally, women do not pick this up. And also, if you have irregular periods, you go to a doctor. That this is younger girl, like my girl is 14 now. If I take her to the doctor and say, okay, she has irregular periods, you're given a mini pill straight away. Okay, you have this for 3 months, periods will regulate. This is quite common practice. So we miss that chance of diagnosing sometimes, as well. And also, if pregnancy is not in question at that time, so unless somebody is trying to get pregnant, many times it's not even looked at up to that point.
Wow, so it's not even considered something overly serious.
Yeah.
And the big challenge, of course, is all medication. Certainly, the birth control pill has so many different side effects.
Yes.
It's ridiculous. Some of the stuff I've read, the fact that it can actually, the extreme ones can give you a heart attack. I mean, you talk about nausea and all that kind of stuff.
Yeah.
So, okay, so typically they're given a pill, and let's talk about, so PCOS is the most biggest reason why people are infertile. Um,
One of the biggest reason.
well,
Yeah.
one of the biggest reasons. Okay, so how can somebody spot, without going to their doctor, how will they know if they've got PCOS or early stages of PCOS?
They should suspect if they are overweight, if they have started to see some bald patches, they're losing a lot of hair. As it is only, generally happens in younger girls. So it is generally picked more by younger girls and their parents together, rather than just only the woman, because you are much younger at that point and not independent yet. But these are the signs that you should pick up if your weight has suddenly increased, and also that you're not able to reduce weight, even if you're not eating enough, or you are having low, what we call the low calorie diet, and you are having less diet and more output in terms of exercise, and still you are not losing weight. There are chances that something else is going on, something hormonal is going on. So weight is an issue. If you have excessive body hair growth, you see that there is a lot of hair on your body. Also, acne is one of the key events that can tell you a lot about whether there is any hormonal issue going on with you. And this acne, which we see in PCOS, is much more pustular, as we call it, is full of pus, and the actual pimples are much bigger for girls.
Right.
And acne, which is not resolved by the normal, the creams that you could pick up. So these are few signs that, and irregular periods, of course, if periods are not regular, or that they don't get period at all, it's been 2 months, 3 months, there is no period, and they have no idea when the period is going to come next. So that is one of the signs that something is going on. More likely PCOS is going on.
And so what are the consequences? I mean, you've said some of the symptoms. What are the consequences of someone having PCOS and they're probably, let's just say they've got all the symptoms? What are the consequences further down the line?
We can talk about, I think the biggest, well, of course, it's the girls or women's health is the main concern. They need to have regular period. They need to ovulate regularly for their own health and well-being as well. And then fertility. If those girls and women who want to conceive later in their life, they need to have regular ovulation, which is an issue in PCOS. We do not see regular ovulation. Even if you have periods, sometimes you have periods without ovulation, where they're called anovulatory cycles. That is also common. That is there. And because PCOS is then linked to insulin resistance, so type 2 diabetes is also one of the consequences that will happen further down the line if you're not careful. Cardiovascular disease, hypertension, and heart attack, as you mentioned before. If you are not careful and you do not if you don't change your lifestyle, to say.
Yeah,
So,
absolutely.
yeah, those issues.
Okay, so you mentioned two of the big hormones you mentioned already, insulin and testosterone. And just to clear, of course, you made it clear that we all, men and women, have testosterone. And just to give it a bit more clarity, both men and women have more testosterone than for women, of course, than progesterone and estrogen. Now, you say it's a big increase in testosterone. What kind of percentages are you talking about? Just to give people context. I mean, taking a steroids is a big increase in testosterone, right? It's so what kind of levels are we talking about? That is big.
I cannot actually quote you in terms of percentage, but it is not a big increase from whatever the testosterone levels are there in women. It's only slight increase, but that increase is significant because in women, testosterone levels need to be much lower as compared to men. So in men, if little increases can be adjusted because he's a man, but in women that cannot be adjusted because then it starts to have a knock-on effect on your hormones and insulin resistance. And insulin.
So in the work I do with type 2 diabetes, one of the things I want to read this to you from a scientific paper carried out. I'll just read it to you. In May 2020 in the National Library of Medicine. It talks about the invasive fungal disease in patients with type 2 diabetes, and I'll bring it back to you in a moment. In essence, it's saying, so they did a study with 120 patients with type 2 diabetes, and they found that 46.7% had yeast infections, including candidiasis, which is 55% of them. Cryptococcosis, 44.6% was common. Urinary tract infection as well with candida. More than half of the people with cryptococcosis, 64%, presented with pneumonia later. Mold infection, and there's a reason I'm coming to this. I'm not trying to scare people. I'm just trying to bring the science to you. Mold infection accounted for 40.8%, and it involved mainly the lung. Now that's important to know. Mainly the lung. Just think about the disease that's been going around for the last couple of the virus has been going around for the last couple of years. What's it been? Who's it been attacking most? People with type 2 diabetes, and so there's other infections that I could talk about. The study talks about, and the reason I mention it is sugar. Sugar is the cause. Well, it's the one that feeds all these toxins. You got all these fungal species, but they're also creating toxins from their metabolism and the metabolites that they create. How does that shift? I mean, is there any change in PCOS? Is there more? Is there less? Is it about the same?
You
With
mean
infections?
the fungal infections?
Correct.
Yes, there will be more fungal infections with women with PCOS because it's a sugar metabolism issue as well with insulin resistance. And also there is a very strong genetic and hereditary link with PCOS. Women who have PCOS, they have hereditary and genetic link to their parents and grandparents who have diabetes. So we see more PCOS in those families. Yeah. So because of that, there is already impaired sugar metabolism. So because of that, and also there is more tendency for these women to eat sugar. Yeah, they are eating more sugar. And then we see that there is direct link between sugar and all these infections, all these fungal infections, especially. I mean, you drop the sugar, fungal infection drops straight away.
It's interesting because in order for the fungi to exist, you have to feed it.
Yeah,
And people get cravings for their sugar. It's because it's like, let's put it this way, you've got an alien species in your body which
yeah,
is actually making you think that you want sugar. It's not that you want
yeah.
sugar, it wants sugar, and it is creating the biochemistry for you to think, oh my god, look how terrible I am. No, it's not that you're terrible, it's not that you're a bad person. Shouldn't be shaming yourself, just be aware
It's the
that
microorganisms
it's
asking
the
for sugar.
exactly. So, okay, so you drop the sugar, but what about all the toxins that accumulate? I mean, there's so many different toxicities, of course. What about all the toxins that accumulate as a result of just those fungal yeast species? How do you get rid of those?
Yeah, we can talk about that. I mean, I'm going to talk about more, holistic solutions, how we
Hmm.
can, what we can do. Uh, if we are particularly talking about bacteria and fungi and even the viral load that we have inside our bodies, is to do with the food, is to do with the gut cleansing. And we as an Ayurvedic practitioner, I recommend going through detoxification.
Yeah.
I recommend Panchkarma, as you know, and we are going to be looking at that soon as well and talking more about Panchkarma because it cleanses really deeply from your gut. There are a number of ways to cleanse your gut because that's the main where all of this is going and is the biggest house, of
Hmm.
the all kinds of microorganisms.
Hmm.
So it is cleansing, which we can talk about separately, but
Yeah.
you can cleanse it from the gut.
Okay, so coming back to, you mentioned hereditary. So if a woman currently watching, or a man with, well, somebody who's got a partner who's a woman has PCOS, and they do find it, they end up being fertile, and they somehow, do that, and they end up with children. What can, I mean, is it gonna, if you said there'll be some hereditary element, what else goes on for the children? Is there any other serious consequences?
Yeah, like we were talking about this, and one of the studies, or many other studies, I'm sure there are. One of the studies that I looked at, so the effect of um, the woman having PCOS, and when that woman has children, there are more diseases that those kids are more prone to, more hospitalizations, more asthma, more infections of all kinds. And I do, um, there will be more chances if, or predisposition as we call it, towards type 2 diabetes as well. If that woman hasn't changed the lifestyle, and with PCOS, you had the IVF and you're successful, or even naturally you tried to get pregnant, you're successful, but you haven't really changed any lifestyle or your dietary changes, then you are passing on that predisposition to the kids.
So I'm just looking at one of the studies that we were discussing earlier on, and this was a study, very big study with over 1 million children born in Quebec, Canada. They said researchers found that the children of mothers with PCOS were 32% more likely to be admitted to hospital with a
Yeah,
variety of health problems that the children of the mothers without, compared to the children of mothers without. And they were 31% more likely to be admitted for infectious disease and
yeah,
47% more likely to be admitted for allergy related problems such as asthma, which explains how the heck asthma is going through the roof year on
yeah,
year. I mean, when I was a kid, nobody had asthma that I
exactly.
was aware of, but now everything's just shifted. So is there, in with diabetes, of course, we, and this is very closely linked with PCOS and diabetes. With diabetes, there's also an ethnic element that
Yeah,
6%, sorry, a person from South Asia, so we're talking about India, Bangladesh, Pakistan, Sri Lanka, that kind of region, is 6 times more likely to develop type 2 diabetes. African Caribbean, I understand, about 2.2 times or 2.5 times. Is there any correlation between PCOS and people from the subcontinent?
absolutely. Yes. So South Asian girls have more PCOS. It is also it's increasing. The tendency is increasing, and we are getting more and more girls being diagnosed with PCOS, because I see more and more South Asian girls who are having fertility issues because of polycystic ovarian syndrome.
And you mentioned about food, and it just befuddles me that we are from the part of the world where we make the most amazing sweet called mithai. For those of you who don't know, it's called mithai. South Asian sweets, Indian sweets, Pakistani, Bangladeshi. It is most amazing, but all it is very highly colored sugar in different forms. And so traditionally, we are not only genetically but traditionally, the way our traditions are, celebration involves absolutely overloading with sugar, so that kind of doesn't help. I d-
Actually, initially it didn't start like that. It was natural sugars. People used to have maybe a piece of gur or just a date, to sweeten. But over time, as people are cutting down costs, they are using refined sugar more and more and more in mithais as well. It didn't start out like that,
right.
but here we are.
Yeah, so let's talk about some of the holistic approach then. What are
Yeah.
the different things we can do to start, or someone can do who's got PCOS, to start getting rid of it, basically?
Yeah, well, first thing, what most women think is that they can never get rid of it. I have to agree that there is this what we call a spectrum of polycystic ovarian syndrome. So if you are more on the milder side of PCOS spectrum, there are chances that you can reverse it. If you are on the very extreme side of it, and then there are chances that you can reduce it. You may never be completely reverse it and be able to reverse it, but you can improve your standard of living and not have any symptoms. Some cases are very extreme, and we may need to still use modern medicine, drug medicine, along with natural medicine for them. But there is a lot one can do as far as natural medicine is concerned.
So one of the big issues that we've discussed many, many times is how just it doesn't matter what the disease is. If it's a chronic disease and people have to make lifestyle decision
Yeah,
changes,
it starts
they
from
they struggle with it, not because they can't. It's just that the motivation isn't there, the desire isn't there,
yeah.
and also you get it started, but then it's easy to give up, and many people do. It's like going to the gym. I was talking to a client who said, Harun, I've joined the gym, and I went for my first session, and she was so excited. I wasn't horrible about it, but I said, look, let me know how it goes by next week or the week after. Let me still, and you know what? 2, 3 weeks later, I spoke to her about it again. I said, how's your gym been? Oh, no, I only been once. I said, yeah, there you go. So you have to have enough reason. So let's talk about tackling the causes. Let's start off with, well, the usual stuff we talk about, at least particularly through Ayurvedic medicine, the body constitution or the
Yeah.
doshas. Are there any predisposition for certain doshas to get PCOS?
Yes. So kapha, as we know, so there is vata, pitta, kapha, three kinds of doshas that we have. So the more kapha you have, more chances of sugar metabolism impairment and more chances of PCOS. So you can see that when you do more what we call social studying of families, you can see in the families where there is more diabetes, more sugar is being used or consumed. You can see there is also that type 2 diabetes is there, PCOS is there, because it is kapha related. And kapha is people who are much more bigger, they have more weight or weight issues, and they do like or eat more sweets. So it is more retention of kapha as well. So you need to, work on that. And same goes for type 2 diabetes. It is more common in people who have got more kapha.
Yeah. And then so the big issue, of course, with any person starts off with nutrition. It's not the only thing. Starts off with nutrition, and
It's a
the
big
big
thing.
it's the big thing. And I was talking to somebody earlier today who goes to the gym and said, oh, I'll do so much more exercise and I'll lose weight. Well, if you're still eating crap, you're going to have a challenge, and
Yeah.
that's the thing. And so the big consideration for yourself, we all need the three macrobiotics, of course: protein, carbohydrate, fatty acids, fat. We need all three. Is there any, well, we know to avoid sugar. By the way, if you're watching this show, make sure you like, make sure you subscribe. And on the 25th of September, we're going to launch our brand new YouTube channel, Spotify channel, etc., called the Natural Medicine Podcast. And I'll continue just talk about diabetes. So it'll be Dr. Ashish and I. It'll be absolutely breakthrough. And I'd love for you to get involved. So just type in "count me in" wherever you're watching this live or replay. Type in "count me in," and then we will keep you informed and we'll invite you to the launch. So, would love to see you there. So, so starting off, just, what? Sugars are poison. That's it. That's all you need to know. And there'll be a lot of people say, "Oh no, don't take sugar." I mean, a lot of PTs and people who half nutrition trained will say, "Oh no, sugar is fine." No, sugar is not fine. Yes, you need simple sugars. You need glucose, fructose, etc., etc. But the fact that you have a craving for sugar tells me two things. One, there's a mental health issue which is challenging you. Very simple. We've talked about that in the chronic stress episode, but we will talk about it another time. So one is a mental health issue going on. Doesn't mean you're nuts or anything, but there's something telling you need to satiate that craving. If you have a craving, that's already a physiological mental problem. But of course, we also talk about the fact that there is no mind-body connection because the mind and body are one. Yeah. And so there's a physical, the fact that you need something, you need water. Without water, you'll die. Try 3 days without water or having any foods which have got high percentage of water. You will die, right? 3 days, I don't even know if you go beyond 2 days. But people are known to survive on water and fast, go without food for up to a month, right? So straight away, yes, you need water, but you don't need, like really desperately need everything else. So sugar is the first thing. It doesn't mean you have to stop potatoes, and a lot of people talk about that. It doesn't mean you have to stop rice. It's the way you prepare it. Simple technique. Rice, potatoes, white potatoes I'm talking about, you prepare today to eat tomorrow. Stick it in the fridge. And what will happen is your glycemic load will plummet. So you won't have a big sugar spike. So keep that in mind. So, but besides that, Ashish, what foods besides sugar, is there any particular foods to avoid completely? And we'll talk about what you can eat, by the way. Is there anything to avoid that I haven't just talked about?
No, you've mentioned sugar. Sugar is the biggest culprit, of course, in type 2 diabetes, also PCOS. However, as I always say, it starts from your body-mind constitution. First, find out what is your dosha, what is your body-mind constitution type, and you have to eat according to that.
Right.
Little bit of sugar as part of wholesome diet is not going to harm you. But when you are trying to achieve a certain goal if specifically related to PCOS, if you're trying to lose weight or if you're trying to get pregnant, then dropping sugar completely will really accelerate your speed in terms of your healing or getting pregnant. Yeah. But it is your diet is according to your body-mind constitution. There are no other specific foods that you should not be eating, but yes, carbohydrate rich foods you need to take less of. Low glycemic index foods you need to take more of, or low what we call sugar release, where the sugar release is much lower. So more also to take more fiber in your diet because it helps with the slow release of the sugar. Rest is all the diet which is full of what we call natural proteins, or proteins that come from not animal sources. So that comes from plant sources is what you need. Lots of dals and pulses and beans will be really beneficial here. And the other thing was the fat that you are taking. So no trans fat, absolutely no. I don't know why somebody would be taking trans fat anyway, but margarine or any of that kind of stuff is deadly for your body. So you don't want to have that. You want to have healthy fat. You want to have ghee. You want to have actual butter, but no margarine or other trans fats. or food which has been fried in all of the big chains.
Right, exactly. So, and I keep this in mind. If you have got PCOS, it's probably destroying your self-esteem, self-worth, or self-belief. It's
Right.
probably not making you feel too good. So, and the question is, you might say, for example, I was talking to, I talk to a lot of people, clearly. I was talking to someone today earlier on, and he was suffering from a lot of depression and agoraphobia, but somehow he managed to get himself out the house, and he started going to the gym, and he believes the gym saved his life, gym and the swim and sauna and so on. He does that, and he said all it took was not thinking about it, just taking that first one step in that direction,
Yeah.
first one step in that direction, and then the next one, and then the next one, and you will be able to shift it. I mean, and if you have got advanced form, of course, this is where the Dr. Ashish, she actually, I mean, I haven't done that much work with people with PCOS, I have to admit, but Dr. Ashish, so you definitely want to be talking to her privately. So don't lose hope. That's the key thing.
Yeah.
Do not lose hope. Hope is there for you. Now, you mentioned about butter. Now, there's a lot, the way butter is created, of course. My concern with butter, I'm not a vegan or anything like that, but my concern with butter is how the cows are raised
Yeah.
and how they're treated, etc. And the
Organic, but
best, oh, you want organic butter and stuff which is pasture raised cows.
yes.
So in the UK, for example, the only one that I can think of is Kerry's butter. In America, I know they have a whole bunch of different choices. So keep that in mind. Also, you mentioned about meat. Now, one of the things that people might not be aware of meat is this: unless it's free range organic,
Yeah.
and you want pasture raised, by the way, not even free range. Free range might be a big cage that they run around in. It's still not free. Free range, pasture raised,
Yeah.
organic, no
Absolutely.
chemical, none of that, no vaccination and so on. That's the kind of chicken or meat that is maybe okay for you. However, in mass farming production, it's not their fault, it's just the way society is developed. The amount of hormones,
Yeah.
the amount of steroids, what do you call it? I
Growth
forget the name.
hormones.
Growth hormones,
Yeah.
all of that. That's the last thing you need in your digestive system,
Yes.
because if you're already having hormonal troubles, the last thing you need is to add more hormones to it. So just to reiterate,
Yeah.
ghee or pasture raised, if you're going to pasture raised
You're not
grass
talking
fed
about
butter.
We are not talking about eating meat every day. Meat should
No.
be part of your healthy, wholesome diet twice a week, and fish 2 or 3 times a week. Fish will be very healthy for women with PCOS. But yeah, it's not excessive amount of meat is no good for anyone. But for PCOS, animal protein is to be avoided, especially red meat.
So we'll talk more about Punch Karma perhaps fully in one episode, but just for now, can you give a bit more detail about what Punch Karma? Because most people wouldn't have heard of it, to be honest with you. What is Punch Karma, and in what way is it a very powerful detoxification tool?
Absolutely. Panch karma is Panch means five and karma means action. So there are five main actions that are used in this. It's not a detoxification program. It is one of the things that this program does. It's a rejuvenating program,
Right.
which lasts from 3 to 4 weeks or even longer, up to 5 weeks. It is traditionally done in a retreat setting that you go away from your normal life and you stay in a hut and you do this whole systematic release of toxins from your body. um, and there is no other system where there is an effective program like this, going from one step to the next and the next and so on and so forth. But there are five main actions that you do. So it is a lot of gut cleansing that happens, and it is about doing oiling, taking ghee internally by mouth, also oiling your body as well first, and then taking ghee internally. And then we do purgation. We also do emesis, induced emesis. And then there is basti, which is like colonic, but it's much more healthier form of cleansing. we do that. So it's a 5 of those actions. We will talk in more detail because it is much more detailed process that happens. Otherwise, we'll lose the whole episode to Panchkarma.
Yeah,
But
exactly.
with PCOS, women who would like to either lose weight or they want to, cleanse themselves, particularly if they are in an environment where they are using or surrounded by a lot of hormone disruptors, as we call them, or they have much more load of hormonal disruptors around them in their lives, then it is a good idea to inquire more about Panchkarma or a deeper detoxification program. And I have not seen anything better than Panchkarma.
Right, right. And so if someone's got PCOS and they're seeing the issues with excessive hair on the body and hair loss in the head, they're going to have a lot of anxiety issues, a lot of stress, a lot of worries, and maybe feeling like doomsday is happening for them.
A lot of
So
body image issues as well.
yeah. So
Yeah.
is there anything that you do that will help, or you can suggest people can do to address those particular issues beyond the physical? I'm talking about the mental health stuff.
Absolutely. So the women who have PCOS, because they generally tend to have weight issues as well, they have body image issues. They have body image issues also because they start to lose hair. So they might be going little bald. So they are very conscious of how they are looking. If they have excessive body hair growth, or also on the face, for example, they'll have some mustache or some chin hair that they're growing, so they do feel sad, they do feel depressed. It is quite common for PCOS women to feel that way. Of course, we treat or manage all those issues along with how I work with women holistically, using natural herbs, using natural therapies, so that we can actually get rid of as much of PCOS tendency, and then these symptoms will then eventually calm down. Yeah. So if they are losing a lot of hair, if we have worked on gut, if we have worked on their diet, we have given them herbs to balance their hormones, periods are becoming regular, they will see that the hair loss has reduced. Yeah. But it is something which, especially if the issue has been there for many years and has never been addressed, then it is going to take some time to work on it.
And from my own perspective, is just always going back to the cause, of course, like you do. And if you've got type 2 diabetes, there are 5 major causes: leptin resistance, which comes with basically being overweight. So what, and we're going to come back to that in a minute. Chronic inflammation, which will come from the foods that you eat, but also from stress as well. There's many things that can cause that, but the food you eat has a significant impact. Insulin resistance, we already talked about. It means that your insulin is not able to transport sugar from the blood into your cells. We have oxidative stress, which is to do with the environment internally and externally. In other words, you're creating free radicals. So, and then the big one is chronic stress. And they're all very big. Chronic stress. So in terms of, I know we talked about pranayama, which is yogic breathing, which absolutely is mind blowing. And this is, we'll come back to that I want to talk about something else as well, but it's mind blowing to me that some of the great breathing exercises, people like Wim Hof, they've taken, and I'm really happy to say that, taken yogic breathing techniques and applied it and made it Western kind of thing, which is great in some respects. There's many things you can do with different types of breathing techniques. That's so important. So the BioWell device, which is a piece of kit that I use to help measure people's energy balances, energy fields, the movement of light within their body for all the major organs and systems. Here's what happens when you breathe correctly, and I've done it so many times with different clients. When you breathe correctly, it balances out your body so much better. So if you are somebody who's suffering from PCOS, it's so important to practice breathing techniques. Where do you do that, or which way to do it? One, through meditation. The other one actually through yoga, but not just any yoga. There's a lot of yoga teachers do it as a simple exercise. That's not what yoga is about. You're missing the whole damn point. It's not a simple exercise. It's actually something which is a lifestyle which integrates mind, body, soul, and all of that together. So we're rapid. Oh my God, I thought we were going to do only 30 minutes. We're still at 39 minutes. So is there anything else you want to share about PCOS, or we'll do a separate episode on Paranchakama, of course. Is there anything else you want to talk about PCOS? Are you good?
No, I think it is about understanding where your body mind constitution is, eating food according to that, doing more deeper cleansing work with Panchkarma if that is suitable for you. Of course, that can never be done on your own. You will have to go to a practitioner to find out and to be able to do that. Working on your diet is the biggest, all the studies have shown to do with PCOS, that your diet is the biggest step that can make the change in terms of managing PCOS. Long term, we are not talking anything short term here. It's a long term, and you always have tendency for PCOS, and it can go out of hand if you are not, working and managing all the things in your life. And then you spoke about pranayam. Of course, one of my favorites is to do the yogic breathing. And of course, any other type of exercise, whatever you like. If you're a gym person, go to the gym. If you are an outdoor person, then cycling or going for a walk or brisk walking. But all these, if you're working with a practitioner, then all of these can be adjusted and can be supervised as well for your health and well-being and for PCOS. And if you're trying to get pregnant, of course, there are many more therapies that we can do in-house, and the things that you can do yourself as well.
Beautiful. Brilliant. So, I just want to remind people a couple of things. First of all is join us for our launch of the Natural Medicine Podcast, 25th of September, 2022.
Yeah, we are making the logo, getting the logo ready.
yeah, we're working on the logo, and it looks comedic, the one I designed. But anyway, yeah. And one of the things we do want to know from you, though, is, and this is done in confidence, is I would like for you to register, sign up to our email reminders, really. And what I'd love to hear from yourselves is, and it'll be done totally in confidence in terms of we won't mention your name, is what are your top 3 health issues you want addressing, whether it be physical health, mental health, actually spiritual health as well. What are the core issues you want to address? Because here's why I say that. Over 66% of all the hospital stays in the United Kingdom is just for chronic diseases, lifestyle diseases. I don't know the number for autoimmune diseases, but that's also very high. So in other words, what I'm trying to say to you is most diseases, the long-standing diseases, most of them are either preventable, well, they're definitely preventable because they're lifestyle choices, or they're certainly more than manageable. Some of them are very, very reversible. We can't blatantly say that in public, of course, in the public arena.
We can't claim it.
well, we can't claim it. But the reality is that if you were to follow natural methods, then in most cases, without too much intervention, you can heal yourself.
Yeah.
And truth is, actually, all healing is you healing yourself. Keep that in mind. All the healing that ever done, I do not heal somebody. Ashish doesn't heal somebody. We create the conditions to accelerate the healing, but actually the healing is done by you. So if the healing is done by you, then the education we're sharing with you is to create the conditions on your own to do it for yourself. Because guess what? The National Health Service in the UK, the health service in the US, in Canada, in most countries except, say, Norway, for example, are absolutely pants. They're falling apart.
Yeah.
And I used to work with the NHS. I used to work with the top medical devices company, very closely with the National Health Service in the UK. It was marked for breakdown and dismantling back in the 90s, probably before then when Thatcher was around. So you can't rely on that. And today, one of my friends, she was in an accident and emergency. I don't know what with, but she's posted on Facebook. I've been in A&E. I've been here 4 hours, and there's 183 patients and only one doctor. So can you see this isn't going anywhere? And so if you don't take responsibility for your health, Who is? Are you going to wait for all the pain and the suffering and, the losses and the bereavement before you go, oh, maybe this crap ain't working. Maybe I should take ownership and responsibility. And moreover, it's not just, it's about yourself. If you've got family, a partner, certainly if you've got kids, there are so many things you can do. Like we talked about PCOS today. If you're a mother or father watching this, or a teacher watching this, you'll be able to point the child out, the young adult out,
Yeah.
point them to the right direction rather than for them to suffer for another 2-3 years before they even diagnose.
Yeah.
That's my little motivation rant. So, in other words, get off your backside and take ownership of your own health. Next week, I'd love to talk about, and I'm sure you'll agree, hope you agree anyway, I'd love to talk about erectile dysfunction.
I would love to talk about that.
So, if you're and I'm going to do it jokingly because I'm not taking the mick, but I will do it jokingly to make it lighter, only because it needs to be talked about. If you're a man and you can't get it up, you need to watch or listen to this next
Listen to
week's
our
episode.
podcast.
Yeah, listen to the podcast or watch it on YouTube or wherever you're watching it. So if you are a man who's married, there's a big statistic. I don't want to scare you too much, but the statistic says that your partner will consider, they may not do it, some will consider cheating in order to get her needs met, because a woman has her needs just as a man has her needs. And the thing is, if you've got erectile dysfunction, of course, guess what? You can either prevent it, which is very important, of course, or you can certainly, I believe, and I'm not a doctor, so I'm not making any massive claims, but I believe, it's my belief, my personal opinion, that you can reverse it. And we'll touch on some of the subjects. We won't go into too much detail of anything, but we'll give you enough for you to think about. So, Joe, good to hear from you, Joe. I know a woman who's diagnosed with PCOS. She's intermittent fasting and trying to reduce carbs and hence insulin. Anything else she should be doing? Well, first of all, Joe, intermittent fasting is brilliant, absolutely brilliant. I would make it the gap between meals, so make it a fast 24 hours if she can do it, and then make it longer and longer as long as she can. Don't go beyond 3 days, but it has a major effect, because in essence you're doing a lot of detoxification. That's one thing. Reduce carbs again. Be smart about the carbs. You don't want to cut out carbs, because you do need carbs. I know the keto people might, go up in arms, or the carnivore people might get a bit cheesed off. But guess what? We do need carbohydrates in our body. However, you can be very smart about the carbohydrates that you take. So you want to take low glycemic index carbohydrates. And is there anything else she could be doing besides what we said? Is there anything else?
No, you've mentioned that is correct. With intermittent fasting, although I have seen a lot of people doing intermittent fasting wrong, and then it has side effects on your gut, how your gut then behaves. It's just all bloating and indigestion and all of that. So I always say go to a practitioner so that you can start intermittent fasting properly and not just following any method online. That would be my advice. And other thing to do is brisk breathing. So breath work, which is much more intense, that will help you to work on your gut, and it helps you to lose weight.
And one thing that people don't talk about much is the fact that when you're fasting, especially the longer fast, you are also, as well as depleting yourself of food, you're depleting yourself of gut bacteria, the gut biome. I presume that's what you're referring to. Is there anything else? So you're depleting that, and your gut biome is responsible for 70% of your immune system. So you need your immune system intact. So you're 100% correct. We should stop giving people advice, because people follow bits and pieces and not do it properly. Yeah, go to a practitioner. Go to somebody who knows their stuff, someone who's experienced, someone who's qualified. Go to someone. And, it's great to have Google and Yahoo and whoever. I don't even know Yahoo still exists, but great to have Google, Bing, and all these other guys, and Facebook and TikTok. But truth be told, with my clients, even when a brief consultation, I don't prescribe. I don't say do this and that and the other. What I do is I do a thorough analysis of their condition.
Yeah.
I look at everything, and same with Ashish. We look at every single aspect and say, right, what are the possible root causes of this person's condition?
Yeah.
So, if you got someone who, I work with people with type 2 diabetes, primarily business owners, scientists, engineers, and so on. If I've got 100 people with type 2 diabetes, I can guarantee you, after the analysis is said and done, there's 100 different causes. In other words, 100 different permutations of the
Yeah.
causes. Does that make sense? So trying to hit somebody with the same generic idea or strategy to get better, just it's a route to failure. So you're 100% correct. So thank you for sharing that. So thank you very much, everyone, for watching. So make sure you join us next week live, 7 p.m. on the various channels, YouTube, LinkedIn, and Facebook. And make sure, Ashish wants to say something. Make
Yeah.
sure make sure you stay in touch with us, because we'll start announcing we've announced it, our launch date of the new podcast, Ashish and me talking about stuff, going even deeper, just natural methods and so on. We'll be launching the Natural Medicine podcast. Ashish, you want to say one more thing?
Just to finish off, I just want to say that PCOS does not necessarily mean that you are now have to live with it for the rest of your life. You don't actually have to do that. But it does require your effort. If you're ready to work on yourself, then go and see a practitioner, whomever you find, you can connect with, or if you want to come and see either of us, then come and see us. But take that advice from a supervised, what I call supervised advice, and then work on it. It is reversible in many cases.
Brilliant. Thank you so much. And thank you for bringing so much hope to so many women, or at least the women who are watching, and possibly beyond. So see you all next week, guys, 7 o'clock UK time. And bye for now. Thanks, Ashish. Bye.
Bye.